Good morning. Good morning. Happy Wednesday. Happy Wellness Wednesday. I hope you are feeling well today. If you are just stumbling on my page, my name is Donna. I'm a mom, a nana, a girlfriend. I am a jazzerciser, line dancer, runner, advocate for all things wellness and mental health related, and studying for my Master of Science in Clinical Mental Health Counseling. And if you're just stumbling on my page, I'm super glad you're here. If you follow on a regular basis, I'm super glad you're here too. I hope you enjoyed last week's video on bipolar disorder. Last year, where this started was last year I covered misunderstood mental health conditions, and by popular request, today is the last in a 6-week mini series where I broke down some of those most commonly misused, misunderstood mental health conditions. And by misused and misunderstood, I mean things we throw around in casual conversation or use to describe personality traits of others when we really don't have much knowledge about those true disorders and what they really mean. In fact, I'm actually a few minutes late this morning because I had a couple of epiphanies when I woke up. Good morning, Miss Victoria. And one of the things that I found interesting when I did a little last minute extra research is that there's a therapist in New York City named Dr. Hirsch, Dr. Weisner, a little bit confusing, a couple different names, who says, I think that when someone breaks your heart, and this is their quote, or treats you poorly, it can be easy to villainize them by calling them a narcissist. Because it is a word that we tend to throw around in casual language. We see a lot of memes about it on social media. We see a lot of videos about it. And that's one of this is the type of reason that I started this mental health misconception mini-series and touched on it a little bit last year during Mental Health Month. Mental health terms that are used casually and out of context cause misunderstanding and add to stigma of real mental health disorders. I also forgot to say, if you're here, let me know you're here. If you don't see this till afterwards, ask a question, drop a comment, hit hashtag replay, whatever. And if I don't acknowledge your comment or question while I'm live, it's because Facebook didn't show it to me, because they can be a little fickle sometimes. And I will answer afterwards. So mental health terms, they're not buzzwords. And they have become that way because we have a new level of interest, and dare I say even almost an obsession with mental health conditions, which is good and bad. It's good because we're paying more attention to mental health. We're recognizing that there are issues there and that they need addressing, but at the same time, almost to the point of an extreme where everybody we look at, even, I'm studying for my Master of Science in Clinical Mental Health Counseling, and I can promise you, and I've been asked, oh, does that mean you're diagnosing me right now? No, I'm really not. If anything, I'm diagnosing myself, which I shouldn't be doing. But seriously, I'm just learning about the reality of these disorders. And if anything, I'm learning not to throw them around in casual conversation because there are so many nuances and just underlying things that contribute to each individual disorder. Some of them have a lot of overlap, which we're going to talk about a little bit today. And so it's easy to toss around terms that we don't completely understand. And what that leads to is labeling. So just to be clear, the purpose of this series, this mini series, is to know a little bit more, because the more we know, the more we can recognize real mental health conditions and act accordingly. But again, I can't be clear enough on this, especially in this last episode of this mini-series. The purpose of this is awareness, not diagnosis. And it's to understand real conditions and not label, and hopefully reduce the labeling that we have a tendency to do. And I'm guilty of the same. So narcissistic personality disorder is a biggie. And that's one of the reasons I saved it for last. And it is one of the 6 that I covered. Well, actually, I covered 5 originally. And I added, when I started this series, I added disordered eating. Again, today's the last day in this mini series, and we'll move on to some lighter, maybe more positive stuff. In any case, narcissistic personality disorder is very misunderstood. It is very overused and very misrepresented. It's often used to describe anyone who seems a little arrogant or self-centered, but it's much more than a big ego. There's so much more to this story, just like there are with any of these other mental health terms. So a few myths and facts to get us started. Narcissists, one of the myths is that narcissists just love themselves too much. And the truth is that most people with narcissistic personality disorder, it is an actual disorder, actually have a deep-seated insecurity that they mask with grandiosity. And that means that they're very, very insecure and very, very self-conscious deep down on the inside, and they project an outward appearance of being extra arrogant and extra self-centered and extra self-assured and all of those things. And we all know people that do this, but just because people do this does not mean they have narcissistic personality disorder. It could be situational, or it could actually be something much more, or maybe much worse. There's a lot of possibilities there. And that's why it's so important, and I'm going to stress this again throughout this episode, that we don't judge because we really don't know what's going on under the surface of someone. So another myth is that anyone who is arrogant or full of themselves has narcissistic personality disorder or is a narcissist. Arrogance does not equal a disorder. Some people, I lost my place. Narcissistic personality disorder involves persistent, and you've heard me say this word before in this series, pervasive. It's a pervasive pattern of dysfunction that crosses relationships and identity. So it's when we see someone who is normally a good person, and then specific situations, they become extremely arrogant, maybe gaslight a little bit. That does not mean they have a disorder. That does not mean they are a narcissist. Because narcissistic personality disorder is a pervasive pattern of this over time and across relationships. Not necessarily romantic relationships, any relationship. Another myth is that you can always spot a narcissist. They're loud and they're boastful. Okay, well, a lot of people are loud and boastful. A lot of people with narcissistic personality disorder are actually quiet, or what we call vulnerable narcissists. And they seek admiration through withdrawal or through passive manipulation. We've talked about passive aggressiveness before. And they'll withdraw or use not talking or not showing up or whatever as a way to manipulate the other person to make themselves feel more important or admired. Self-importance and admiration are keys here. Another myth is that narcissists can't be helped. Like with any personality disorder, there's not a pill. There's not a magic pill. There are medications that can be used to reduce some of the symptoms and some of the behaviors. But with personality disorders, there's no one approved medication for any of them. And therapy is where the change happens. Most of the time, it's cognitive behavioral techniques where you're working to change their line of thinking, the way they react to things, and so on. And then the final myth I have for today is that narcissists are just another version of sociopaths. That's an interesting one. And once you learn a little bit more, you can see where there is a lot of overlap between these two. But the basic differences between narcissistic personality disorder and antisocial personality disorder, because they are not the same, can involve manipulation or lack of empathy. Both of them can involve manipulation and lack of empathy. However, they're very different disorders with very different motivations. Narcissists want admiration. They want to feel special. They want to be lifted up. They want to be the center of attention. Sociopaths are looking to control or win at any cost. And that's a different animal. And that's not one we're going to dig into in this series. We're going to touch on it a little bit today because of the overlap and the comparisons, but that's a whole other story for a whole other day. And honestly, not one I feel equipped to dig into just yet. And I'm going to be transparent, because again, I'm studying, I'm not licensed, and, the world of the antisocial personality disorder can be pretty scary. and even a little dark, and it's hard to wrap your mind around, and it's just not a place probably that's best to go on Wellness Wednesday. All right, so some quick nerd facts. Narcissistic personality disorder affects an estimated 0.5 to 1% of the population. Now, when you're looking at social media and when we're thinking about past relationships and we're doing all of these things, all of this chatter, it sure seems like more than a maximum of 1% of the population, doesn't it? So what that means is that a lot of people can show narcissistic tendencies. A lot of people can display some of those traits. A lot of people can display a lack of empathy and a lot of self-centeredness. That doesn't mean they have narcissistic personality disorder. And you notice that I won't say very often that they are a narcissist. I instead say that they have narcissistic personality disorder, because one of the important things about the stigma surrounding mental health, good morning, Miss Michelle, is that instead of applying this whole label to the whole person, we're recognizing that it's a condition they're living with, and that there is a possibility for change. Okay, so another nerd fact is that studies show that people with narcissistic personality disorder often have a fragile self-esteem despite the show they're putting on the outside. So think theater mask. If you looked at my graphic when I posted it yesterday announcing today's topic, it's somebody on their knees on a stage with a spotlight on them. So the whole purpose of that was to kind of convey that a lot of times with narcissistic personality disorder, what you see on the outside is a show that's totally disguising what's going, or a mask that's totally disguising what's going on the inside. Narcissistic personality disorder and other disorders like antisocial personality disorder can both involve manipulation and often do. That's one of the overlapping qualities. However, there's a significant lack of empathy, or I'm sorry, let me reframe that. The lack of empathy that's displayed in narcissistic personality disorder is driven by grandiosity and validation seeking. Whereas in other disorders like antisocial personality disorder, it is simply driven by a total disregard for others or their rights. And that's generally across the board, not just with the person that may be experiencing it at any given time. There is, again, like I said before, my other nerd fact, and I kind of already touched on it, there is no medication approved specifically for this or other personality disorders. Therapy is always the first line of treatment in this case, because these are deeply ingrained patterns of thinking, patterns of behavior, and patterns of relating, not chemical imbalances. Meds can be used to treat some symptoms and some co-occurring issues. And with personality disorders, there are often co-occurring issues like anxiety, depression, other things. However, there are no meds that are approved specifically for personality disorders, including narcissistic personality disorder. So what does it look like? What does narcissistic personality disorder look like? Here's some basic layman's examples. Someone with narcissistic personality disorder seeks admiration and validation. They may exploit others to uphold a self-image. Someone with narcissistic personality disorder has a need to feel special or important, and they may appear charming in order to maintain that status. A coworker, for example, a coworker who constantly name drops and takes credit for other people's work, but crumbles when their own work is criticized or when they are criticized in general. That is an example of what narcissistic personality disorder looks like. Someone who needs to be the center of attention and gaslights others or reacts with rage or withdrawal when not praised. That is an example of someone with narcissistic personality disorder and how they might behave. What it isn't. And a lot of what I'm about to use here are examples of antisocial personality disorder, because there is such an overlap between the two. But there are other personality disorders that can overlap here as well. So what it isn't. It is not someone who seeks admiration, validation. What it isn't. Someone with antisocial personality disorder or other things going on might be seeking that admiration, validation for personal gain, regardless of the cost. And what I mean by regardless of the cost is regardless of what it may cost them or others. They don't actually care about losing the relationship because they're seeking personal gain. They don't recognize or respect the boundaries of others, the rights. And a lot of times this turns into legal, ethical type of stuff. They may manipulate or harm without remorse, with no regard for others' rights and safety. And that's kind of one of the lines between narcissistic personality disorder and other disorders, is that there is no regard for the rights or safety of others. That's a big deal, because generally those with narcissistic personality disorder are still going to follow the rules. They're not going to be as likely to break the law as someone with antisocial personality disorder. That's one of the big differences. They can be impulsive, reckless, or aggressive, and that's generally not the picture with narcissistic personality disorder. For example, so examples in comparison to the ones I gave for narcissistic personality disorder are a coworker who repeatedly lies and laughs about getting away with it, breaking rules like stealing from the company, and showing no concern for how it impacts others. That's, again, a little bit more extreme. This has to do with a more pervasive violation of others' rights than what we see with narcissistic personality disorder. A partner who cheats without remorse and then gaslights when confronted, and may actually sabotage your friendships, your opportunities, practice isolating you from others. That's not narcissistic personality disorder. With narcissistic personality disorder, it's generally all about them and upholding their self-image, whereas antisocial personality disorder is more about control and more about winning at all costs. So this is someone who has antisocial personality disorder is more likely to exploit your trust with zero guilt and then blame you for the fallout, versus narcissistic personality disorder, again, where they just need to be the center of attention. They need to be admired. They need to be the center of the universe. And like I said, they will gaslight or react with rage or withdrawal when that doesn't happen. But they're probably not going to violate your rights. So I like I said, I was running a little late this morning because I had some epiphanies when I woke up, and I wanted to make sure I was covering this the way I wanted to. So I did a little poking around. Another comparison in layman's terms is that a narcissist will mess with your head, someone with narcissistic personality disorder. And I'm guilty, y'all. I have referred to people as narcissists without having a full understanding of what narcissistic personality disorder looked like. They will mess with your head. They will twist your words. They will make you doubt yourself. They will need constant praise, and they will never, ever take the blame. They may gaslight you and make you feel like you are the problem. But they are usually not physically violent. That crosses a line that in most cases narcissistic personality disorder is not necessarily going to cross. They want to look good. They want to be admired. But they also, because of that, tend to stay within the law. Because guess what? That's not going to make them look good, and that's not going to make them admirable. And they're going to, for the most part, avoid crossing moral lines, at least where others can see. There's a lot of emotional damage that comes along with this if you're a target of theirs. But physical danger is less likely. But make no mistake, emotional abuse is still very harmful and very real. And sometimes dare I say, we'll just say equal to physical abuse in the way that it can damage. Whereas those with something a little more serious going on, they don't just mess with your head. They actually don't care if they hurt you physically, emotionally, or even legally. They can be manipulative, reckless, even violent, and may violate laws without a second thought, without any remorse whatsoever. So at the end of the day, someone with narcissistic personality disorder is going to make you feel like a horrible person. They're going to make you feel like you're crazy or like you're a horrible person, but they're not as likely to physically harm you. Whereas someone with this antisocial personality disorder might hold a gun to your head and then make you feel like it's all your fault or act like it never happened. So the differences are small, but they're important. So for anybody that isn't 100% sure what gaslighting is, let me give you a quick definition from Psychology Today. It's an insidious form of manipulation and psychological control. Victims of gaslighting are deliberately and systematically fed false information that leads them to question everything they know to be true. Often about themselves, they may end up doubting their memory, their perception, and even their sanity. And over time, a gaslighter's manipulations can grow more complex and potent, making it increasingly difficult for the victim to see the truth. Now, here's the kicker. Just because someone gaslights doesn't mean they have narcissistic personality disorder. It also doesn't mean that they have antisocial personality disorder. Everybody has the ability, and I can probably admit to doing it, because I believe that in relationships, whether they're friendships, whether they're romantic, everyone brings out a different beast in everyone. And I can think of at least one relationship where I probably gaslit a little bit. But I can assure you that I do not have narcissistic personality disorder or antisocial personality disorder or any of the others. So sometimes that gaslighting is situational, and sometimes someone who gaslights is just a self-centered jerk. They're not necessarily a narcissist. And this is, like I said, it can be hard to separate the lines, and none of us are going to be clinically evaluating anybody. But the point here is throwing out terms that we don't necessarily understand just because this is what we think it looks like can be very damaging to ourselves and to others. So I feel like there was one more comparison I wanted to do here. So now that we've talked a little bit about the overlap between a couple other personality disorders, thank you, Miss Carla. I'm happy to provide that. I hope it helped. Let's also talk about what the average jerk looks like versus someone who is experiencing narcissistic personality disorder. Okay, let's see if I can. Sometimes my mouth just gets ahead of my brain. So sometimes the people around us are just selfish jerks. They're self-centered. They want to be the center of attention. And when they're not, they get their feelings hurt and they make other people feel bad about it. But that doesn't mean they actually have a personality disorder. Again, these can be situational, and these can be based on a lot of things that do not necessarily indicate a pervasive pattern of behavior over a long period of time and across relationships. Some people may feel insignificant or less than when they are at work. They may feel fine everywhere else they are, but when they're at work, maybe they feel guilty. Maybe they feel like they're not doing enough. Maybe they're putting undue pressure on themselves. Maybe their boss is putting undue pressure on themselves. And so in those cases, sometimes we tend to lash out a little bit. We even kids do it too, and they don't do it intentionally, and it doesn't make them narcissists either. Although when they're little, the whole world they think revolves around them. So by our casual definition, wouldn't that also mean that they're little narcissists, right? Well, no, obviously not. But they do have a tendency they will say whatever they have to say to keep themselves from being in trouble. So and this is what I mean. And the point I'm trying to get across here is there's a lot of things that can look like narcissism. But when we're just like, oh, he's a narcissist because he had a moment, he or she had a moment where they blamed somebody else for something and didn't take responsibility and then made everybody else feel like they were nuts over it, does not mean that they have narcissistic personality disorder. So one of the questions in another article that I was reading, because like I said, I had some epiphanies this morning and I wanted to make sure that I was covering things appropriately, was that the topic of narcissism draws a lot of clicks on social media. Hundreds of people are eager to know how to protect themselves and whether or not they're in a relationship with one, or used to be. It's easy to see the appeal of armchair diagnosing, especially when we only have a little bit of information. We're always going to cast somebody as the bad actor in our story, right? And it's easier if we think that they have something where they can't help themselves. Sometimes it makes it a little easy for us to swallow that we've been the target of someone with narcissistic personality disorder, versus somebody that was just a jerk and just made the choice to be a jerk that day. But not everybody can be narcissists. And this article supports the figure that I already threw out to you from I think the National Institute of Mental Health, which is the 0.5 to 1% of the population. But this article questioned, when did we as a culture start using terms like narcissist and narcissistic personality disorder so casually and interchangeably? So it's not just me that's concerned about this. This is a thing. And we need to make sure that we understand the language and that we're not interpreting incorrectly, because when we do that, we can sometimes maybe not see the whole dynamic of the relationship, and how it went south, whether it was a work relationship, a friendship, a romantic relationship, whatever. It's a lot easier sometimes to blame somebody else, especially if we can coin a disorder, so that we don't have to take any responsibility for the demise of that relationship on ourselves. Now, does that mean you should blame yourself if you've truly been the target of someone who is being manipulative and gaslighting and being a jerk? Absolutely not. But unless there truly is a disorder, and sometimes even if there is, there are often things that we can look to for learning, for the future, to protect ourselves, like making sure that we're not enabling, and that we're being real with ourselves about what we're seeing, and that if we do feel like our boundaries are being violated physically, mentally, emotionally, that we draw those lines in the sand, or that we back off and we recognize the red flags. And that doesn't have a darn thing to do with labeling or diagnosing. That has to do with recognizing that how we respond can sometimes make a huge difference. And again, if we are dealing with somebody that has antisocial personality disorder or is willing to violate boundaries legally and physically, that's a different story, and that takes a different approach. And a lot of times we don't pick up on this until we're already so far in that it may be difficult to protect ourselves. But again, that's a different story for a different day. So why does language matter? I had another example that might help you all. So let me see if I can find it, because I really wanted to be able to put this into terms that, where's my stories? I wanted to be able to put this in terms that like everybody could understand. So I wanted to try to explain it to myself as if I was a child, and see if that would help. So an example of someone with narcissistic personality disorder is, we'll say a CEO. Does this mean all CEOs are like this? Absolutely not. This CEO owns a successful business and represents themselves as charming and visionary. They expect admiration from their employees, and they become enraged when someone questions anything they're saying or doing. They constantly talk about their success and manipulate others into praising them. However, they're not out to hurt others, just to hurt them. They genuinely don't understand how this behavior affects others. But it's because their self-worth is built entirely around external validation. So they need that constant external validation to feel okay, to feel important, to feel successful. Behind closed doors, the person with narcissistic personality disorder is fragile and is devastated by anything that's perceived as a failure on their part. So the key traits here is that they crave admiration. Yes, they probably lack empathy. They're easily wounded by criticism, and they need to feel special or superior. Whereas the person with antisocial personality disorder has a long history of lying, stealing, and violating boundaries with zero remorse. They may scam elderly neighbors out of money, charm their way through jobs before ghosting, and manipulate people to get what they want. They don't care about admiration. They really don't care what you think of them. They care about power and control and getting away with things. They might act charming if it benefits them, but that's purely strategic. So the key points of that disorder are disregard for laws and social rules, repeated lying or deception, lack of guilt or remorse, and exploits others without empathy or any kind of shame. And then you have, like I said, the average jerk, which is, where'd it go? The average selfish jerk is just going to be stories about saving the day by accident or doing something amazing. And they're frequently expressing something that's almost unbelievable about themselves. They brag about their accomplishments, but where was I going with that? I totally lost my train of thought. I totally lost my line. Give me a minute. Most of the time, somebody who's just a selfish jerk is more than likely just going to bore the heck out of you because they're going to talk about themselves all the time and they're going to brag all the time. They're going to get monotonous because mostly they're just going to be talking about themselves all the time. It reminds me of a character on Golden Girls, that talked about weightlifting and talked about their body and everything all the time. And he was much younger, and Blanche was just really, really bored with the conversation. Like, there's no depth here. So a run-of-the-mill jerk might not show up at your birthday party because they're angry with you. They might just be like, nope, I'm not going. And they don't really care if others think they're mean for ditching you. Whereas someone with narcissistic personality disorder is going to show up with the biggest gift and come off as a wonderful partner while in attendance, and then privately they're going to say hurtful things or gaslight you when no one else is looking. So I know there's a lot of overlap here, and it's hard to hear the differences. But if you have truly been the target of someone with narcissistic personality disorder or something a little more serious, then you're probably hearing things that are familiar to you. And if that's the case, you may need to seek some help in how to deal with that. And I encourage you to do so. So again, I'm done with the examples now, and I'm going to start wrapping up here. But why does language matter? Well, language matters because the casual use of these terms minimizes the pain and experience of those living with narcissistic personality disorder. And it also stigmatizes and minimizes the pain of being in a relationship with someone who experiences these disorders. That's one of the reasons. So now we're not talking just about the person that we may be stigmatizing, but the person who's been on the receiving end of any of this, because there can be a lot of pain involved there too. Overuse of the label contributes to confusion with other personality disorders, because again, as we saw, there's a lot of overlap here, and there's also overlap with other personality disorders in the diagnostic manual. So when we're just throwing out one term because a few symptoms seem to fit, we could actually be describing someone that has something completely different going on, and we don't know because we're making assumptions. And finally, using clinical terms accurately helps people seek help. It helps identify toxic patterns. And it helps them to not feel alone or mislabeled. So it's just super important. So here's my challenge to you, and what I'm going to encourage you with to close this out. Encourage people to stop using terms like narcissistic to describe people they don't like. Selfish jerk might even be a little bit strong, but at least it's not a clinical term that we're trying to label somebody with that we don't truly understand what's going on or what the motivation is behind it. Let me tell you something. When I'm not feeling like I'm doing what I'm supposed to be doing, I have a tendency to make things about me. I start taking a little bit of hit of self-esteem, and I start feeling like if somebody, that old Donna, that old anxiety that pops up where I start feeling like, if somebody, that self-centered people pleaser, where I start feeling like if somebody didn't smile at me like when they walked by me in the hallway, that meant they were mad at me. It might not have anything to do with me. And that's an example of how even I, in a situation, can make everything about me, and I can be a self-centered jerk. Again, that doesn't mean I have narcissistic personality disorder. A lot of times my situations are just that. They're situational. And when I see myself doing it and I'm like, hold up, Donna, you need to back up. What's going on? And when I examine myself, then I can usually figure out why that's happening. But that's not a pervasive pattern for me. And it is a symptom of my anxiety. It does not mean I have narcissistic personality disorder or any other personality disorder. So when we see these kinds of things happening in people once in a while, or the first time we meet someone, people can come across as arrogant. And believe me, I hate arrogance as much as the next person. It may be situational. We may not have any idea what's really going on, and it doesn't mean that they have a disorder. However, there are people that show pervasive patterns of this type of behavior over long periods of time and across relationships, and that are violating physical and legal boundaries. And that's a whole other story for another day. So keep in mind that how we use this language is often what determines whether or not someone else seeks help, whether they're a victim or whether they are a perpetrator. Does that make sense? Perpetrator is a strong word. Someone experiencing the condition that's causing the harm, or someone that's on the receiving end of the harm. Okay, so let's try to stop. I challenge you to stop using the word narcissistic to describe everyday personality traits or describe people that we don't like or that have hurt us. Mental health disorders are not character flaws. They're treatable conditions in almost every case, in some form or fashion, either with meds or therapy or both. And if you feel like some of this is resonating with you, then the best place to start is by talking to somebody, by talking to a professional. So seek help, seek therapy, talk to your primary care physician about a referral if that's something that you need for your insurance to cover it. Visit your local NAMI website for references to local therapists and agencies that can help you with this. Seek medical care. There are options out there for almost every situation, if not every situation. The most important thing is to not feel alone, and we don't want you to feel mislabeled. So healing is possible. You are not alone. Whatever the situation is, healing is possible. And like I said, if something I said today really resonated with you, especially in this case of being on the receiving end of something like this, then it's probably important to talk to someone professional that can help you kind of differentiate what's really going on and help you work through it. So that is it. Again, I cannot stress enough these casual terms. They can be damaging. And more importantly, and we see this meme all over social media too, we need to try to be kind to everyone that we can be, because we really don't know what's going on beneath the surface. Anybody that we're standing next to in the store or ourselves could be the person, the 1 out of 5 that's suffering from a mental health condition in the United States. So it's important to be kind, because what we see on the surface is not always what's really going on. An extreme reaction, an anger outburst could be related to so many things. And it doesn't necessarily have to be a mental health disorder. It doesn't necessarily mean it's not either. So that was the purpose. I hope that those of you that followed this series really felt that strong urge to stop misusing these labels and stop misusing these terms in casual conversation, and to make sure that we try to learn a little bit more. If this was helpful to you, please share it, because the more people that understand how commonly these terms are misused, the better. And as always, thank you so much for being here. Again, this is the end of this 6-week mini-series. Next week, I'm tossing up a couple of different topics. I did have a request from somebody to kind of repeat and expand on a topic I've done before. And then I also have one that recently became salient to me. So, yes, you're right. Absolutely right, Victoria. Thank you for pointing that out. Social media can be very destructive and misleading. There's so much information out there. And not all of it's correct. Not all of it's correct. And sometimes pieces of it are, but again, not all of it. So you can be looking at one piece of information that has some things that are correct and other things that are not. And we are so quick to just believe what we read versus actually, I've gotten to the point where if I see something on Facebook that I'm not sure about, I go and I Google it, I search it, and I find support for it. And I almost never share anything anymore that's informational like that, because unless it's from a known and trusted source, because there's so much misinformation out there. So I encourage you, like I said, if you have questions, go to good sources. The diagnostic manual for, Psychology Today, the American Psychiatric Association, who writes the diagnostic manual, those are fabulous resources. The American Psychological Association, the National Institute of Mental Health. If you want to really know about a disorder, those are the places where you can find the real information that's being used that's being written by doctors and counselors, or that's being used for diagnostics, instead of just whatever random AI or Google search information comes up. So AI can be a very useful tool. Google can be a very useful tool, but it's very important to vet our information a little bit better. So, or if we're sharing information that is someone's opinion, make sure we understand and that others understand that it is an opinion and not necessarily fact-based. So thank you for pointing that out, Victoria. I really appreciate that. If you found this helpful, again, please share. I'm tossing up a couple of different topics for next week. That'll be a little bit less of a deep dive into actual conditions and maybe more on, stay tuned. That's all I have to say about that. I appreciate you being here. I know this ran a little bit long today, but because this was the wrap up to the series, that was to be expected. I hope you found something helpful. I will see you next week. I absolutely will do that, Carla. Yes. So I will see you next week. And in the meantime, be well.